I always wanted to be a doctor and actually went into med school thinking that I was going to be a pediatrician. So all of my stuff in med school was geared towards that, and then got to my third year rotation with OB, delivered my first baby, and then completely switched gears because it was just so magical and fell in love with the field there. I grew up in Florida and then went to University of Florida for undergrad, Florida State Med School. Me and my husband love hiking. That's kind of what brought us to Colorado, and I run kind of in my free time. I always try to be really patient-centered, so it's always a dialogue between me and the patient of here are the options, here's what I would recommend, but what fits best for you. So I try to be really collaborative with them and make sure that they really understand what's going on as far as the treatment, just letting them ask as many questions as they want. You know, I joke sometimes that gets me behind because we're sitting there talking so much, but I'd rather get to know you in that first visit so that we really know that I'm choosing the best thing possible for them. I'm more geared on the OB side, high-risk pregnancy things, and also normal low-risk pregnancies, and you know, with that, vaginal deliveries, C-sections, kind of everything that goes with OB. But then as far as GYN, I do a lot of hysterectomies for abnormal bleeding, tubal ligations, and DNCs for abnormal bleeding. It's great that a major abdominal surgery that used to take multiple days healing from, we're able to do minimally invasive, so with tiny incisions, and they get to go home the same day. You know, I was the first doctor in my family, so I understand that when you come to a doctor's visit, you know, sometimes they just talk in medical jargon, so I really try to make sure that we're on the same page with what's going on and that they completely understand what's going on and then what their options are.